I am Lily Walla. I'm the founder and CEO of Auggie. I'm so excited to be here with you all at Auggie. Our mission is to make parenthood just a little bit easier, whether that's through expert recommendations, a supportive community, access to awesome experts like the people on this call. A huge part of making the early parenting journey smoother is having a postpartum care plan in place. We know that while a lot of focus goes into preparing for birth and what to have at home for the baby, postpartum recovery and support often takes a back seat. But the truth is, how you recover, how you feel, and the support you have in those first few months can make all of the difference. That's why we're here today to talk about building a strong postpartum care team to set yourself up for success. A few housekeeping notes. One, the session will be recorded and we will share it with you if you RSVP to the event in an Auggie DM, and feel free to drop questions in the Q&A as we go, and I'll do my best to make sure the questions get answered. And then we're doing an awesome giveaway, 1-year free subscription to Mavita Health app, which Sarah, we need to talk about because which includes access to evidence-based content on, everything that you need for the motherload. And then a Hey Sleepy Baby course of choice, which Rachel I will also need in a few months. So Dr. Orrick, I'll let you go and give your intro, and then I'll let everyone else do the same.
Thank you so much. I'm Dr. Sarah Orrick. I'm a reproductive psychiatrist by training, and that just means I focus on female reproductive hormones and how they impact mental health, which is very different from our male counterparts. But most research and kind of medical information is based on men, unfortunately. So I'm very happy that this kind of specialty exists. I am the CEO and co-founder of Mavita Health, which is a virtual mental health care platform for the path to parenthood. We do medication management, individual group therapy, and couples therapy. And I'm a mom to 3, and I am currently in Los Angeles.
Awesome. And Leah, hi.
Hi, my name is Leah Trevis. I'm a registered nurse and international board certified lactation consultant with the Lactation Network. And at TLN, we're the largest provider of insurance covered lactation care in the nation. And we do provide care in home if that's what a family chooses. So it's whatever modality a family chooses, whether it's in person, in an office, or in home, as well as telehealth if that's how you want to be seen. And I have 3 children as well, and I'm joining from Virginia.
You guys are inspirations. And Rachel, you too, with 3.
Also in the 3 Club, I'm Rachel. I founded Hey Sleepy Baby about 5 years ago when I was on maternity leave with my second. I'm a former teacher, and now I'm a certified sleep consultant and infant parent mental health specialist. And we work to help families find holistic and gentle, sustainable sleep solutions for babies through toddlerhood, through childhood.
And what I love about how you are as a sleep consultant is no judgment.
No, yeah, there's no one right way. Yeah.
And hi, Jada.
Hi, everyone. I'm Jada Meadows. I'm a doctor of physical therapy and work at Origin Physical Therapy in West Hollywood. I'm also the clinical director there. We are the leaders in pelvic floor physical therapy and do also take insurance, which is very exciting. And basically, we treat anything from pregnancy conditions to postpartum, pelvic pain, painful penetration, and also orthopedic conditions as well. So kind of full body care over here.
I'm so excited. I'm about to have my first Origin session on Friday. And definitely needed. Okay, let's get into it. A lot of expecting parents on this call. So why is planning postpartum support essential for parents? And Leah, we've talked about this together many times. I wish I spoke to a lactation consultant prior to giving birth to my son. Talk to us about how the Lactation Network and just lactation consultants can support leading up to birth, but then also, after, of course.
Yeah. So I think, we think a lot about preparing for childbirth, and I think preparing for postpartum is equally as important, right? Your childbirth is a really hard couple of days at max, hopefully. And it is so important to plan for that. But I think really taking the time during your prenatal journey to think about what supports you need in place postpartum is so important. And something I think we just culturally have kind of neglected and we're getting better at. But when we think about lactation, so many people historically access lactation consultants once they're having an issue. So it's very reactionary. And really, the way that we're trained and designed to work is in a more preventative manner. So we're able to meet with you and your partner ahead of time, talk about what support networks you have in place, what your goals look like. Every feeding journey is super unique. And what you want to do is you want to plan for like your A scenario and then maybe a B, C, and D scenario. This allows you to be empowered if things don't turn out exactly how you want them to turn out. And I think that's just a super important part about parenthood in general, is thinking through the what ifs of the goals that we make. And an IBCLC can support you in that. So a prenatal visit can be really valuable. We can help you choose a pump. If you already have a pump, we can show you how to use that. We can briefly take information about your back to work journey, just to slate that visit when it's time postpartum. But just talking through all of those things with you and making sure that we empower, your partner as well to be a part of this, is a super key part of this. And then also just establishing a relationship. So I think thinking through, is it easier for me to call on someone I already know when I'm having a lactation issue?
Definitely.
Or do I want to do it once I'm like freaking out? So I think just thinking through, caring for yourself in that way, right? Like it's a part of self-care.
Love that, and so necessary. And Jada, talk to us about pelvic floor therapy leading up to birth and why it's so crucial.
Yeah, definitely. So, during your pregnancy and your postpartum period, when you're postpartum, you're not just healing from your delivery, you're also healing from an entire pregnancy. And so during pregnancy, your body is consistently changing for months, and that just takes time to recover from. And so making sure you know how to move your body best while you're trying to heal and take care of a new baby at the same time is hard. And so having some guidance through that can be really, really beneficial. Um, Generally, as a new parent, you're spending a lot of time lifting and carrying and rocking. And because of just the repetition of these tasks over time, it can really give you, aches and pains in your back, neck, shoulders. And so having different ways, having someone to assess how you're moving, give you better movement patterns and body mechanics to just help protect your body can be really, really important and prevent just long lasting aches and pains and really accelerate your recovery. Um, and your pelvic floor is essentially a hammock of muscles for your pelvic organs that supports
Oh,
your
that's a good
bladder.
visual.
Yeah, so I have my model right here if people
Yeah.
are interested. Um, you can look at your pelvic floor. This is your pelvis, and everything in red is the pelvic floor. So really is like a hammock or a bowl of muscles that hold up all of your pelvic organs. Your rectum sits right in the back, your uterus and then vaginal canal is in the center, and then your bladder is right in the front behind the pubic bone. So there's a lot that your pelvic floor does to have to support these organs through pregnancy. And as your pregnancy progresses, there's more and more pressure on the pelvic floor and on all of these organs as you grow. So that changes how our pelvic floor functions. Oftentimes, people just associate pregnancy and delivery with just a weak pelvic floor. But a lot of times, even if there is weakness, your pelvic floor ends up tensing up and having a lot more tension at rest in order to help support all of that increase in pressure. So a lot of times in your postpartum journey, you might notice pain with penetration, you might notice constipation or difficulty emptying your bladder or your bowels all the way.
Yep.
And those might be reasons why there actually might be tension in your pelvic floor, in addition to any sort of weakness or lack of coordination. So a pelvic floor physical therapist can really help you assess what your pelvic floor is doing, and then give you a program based on that. So that's why we try to say, don't just start doing 100 Kegels a day. That might not be what's best for you. And so being assessed and getting a program specific to what's going on with your pelvic floor in your body is ideal and can really help accelerate your recovery. So I think having guidance, even just getting back into exercise, can be really helpful, because generally jumping back into more vigorous exercise too fast can end up making your recovery take longer. So knowing what's safe to do, how soon, and at what intensity is super important.
And I have to guess that the more pregnancies you have, the weaker that hammock gets as well.
Yeah, 100%. And knowing just how to manage your intra-abdominal pressure is really huge too, in making sure that you can protect your pelvic floor over time.
And then Sarah, you and I have talked about this again in the past, but for people that don't know, I was rocked really by postpartum depression, and it started probably around this time last time my pregnancy. So I'm about 6 months along, and there were signs then that I wish I don't know, looked into. So postpartum anxiety and depression doesn't necessarily start after the baby comes. It could
No, actually, a third of cases start during pregnancy. And I think that's really important to note because often we're just thinking about the postpartum, but these symptoms can start early. Like for me, I had horrible morning sickness, which of course is throughout the day. It can be so impairing in terms of functioning. And so for me, that was when things kind of started to especially around anxiety and functioning get bad for me. But I think what's really important to think about is that the number one complication of childbirth is actually mental health issues. It's not gestational diabetes. It's not preeclampsia. And yet we're checking blood pressure every single appointment. You're getting, every woman is being checked for gestational diabetes. And yet a lot of these questions aren't being asked during appointments. Of course, our practitioners are stretched thin. They don't have the time to, but I think it's really important because we're in this system to do the research yourself and to be able to kind of have some preparation for, oh, these are the signs and symptoms, my partner, my family should know about, and how I can really find my best support during this time. And Mavita Health really does that. We have a platform. Obviously, we have clinical care, which is our most important offering, but we also have evidence-based content that you can look through to empower yourself, kind of understand and gain knowledge of what these signs and symptoms look like, as well as community chats to kind of talk to one another, mostly about mental health issues and how you can do some preventative care around it, because that's possible. Surrounding yourself with the right supports, focusing on these things like sleep training or, sleeping, whatever that is, lactation, pelvic PT, those are the things that are actually going to get you through. I know we're all thinking about the right crib or the right stroller, but those things we spend so much time on and they don't really give back to us or improve the outcomes. So
yeah, they make us feel productive, I think, having those things, but not necessarily
absolutely.
supported. What are signs that maybe your thoughts aren't normal from some of that content that you provide?
Yeah, I would say it depends on kind of what stage you're at, but I certainly think if you are everyone has worries, especially when they're a first time parent, but when those are starting to extend to not being able to do the things you imagined, not being able to live sort of this values aligned life. So, for example, like you always thought about bathing your baby and how cute that is and how important that is. I was like, I had so many intrusive thoughts at some point in the postpartum with my first, and we were doing it in the sink, but I would always think of like the disposal going off or something and like something happening to my baby's limbs. And so I'd be like, I can't do it. I can't actually bathe my baby. And that to me is a clear sign of like, that's not aligned with how I planned to be in my postpartum or what I wanted to do. So the minute that you find that you're like not doing the things that you wanted to, I think that's important. If you're not sleeping, if you're thinking your baby would be better off without you or with a different mother, those are all clear signs. And of course, if you're having any thoughts of not wanting to be alive, that's a very, very important sort of flag that you need emergency care. But I think that the transition is so difficult, especially in our current circumstances where parents aren't really supported by our society and our culture. And so I think it's even more important to get the preventative care. Start the therapy. We're also a network. And so that offers a choice that maybe, you wouldn't if it was like an out of network therapist, for example.
Yeah, you make it so easy to really get support. They say it takes a village, Rachel. I sometimes am like, where the F is this village? Because it's not what it used to be, where you all lived in the same place and raised your babies together. Talk to us a little bit about how you can create your own village and your care team that not only supports your physical recovery, but your emotional recovery. And how can a sleep consultant play a role in that village?
Yeah, well, first, I mean, just going off of what Sarah said, I so believe wholeheartedly in preparation before you think you'll ever need it. That was one thing that I did differently in my third pregnancy was I saw a therapist that was especially for women in perinatal period. So she was specialized in working with women through pregnancy, through delivery, through the postpartum. And that's a really huge, and that's why Mavita is so amazing too, because that's so huge to get a therapist that really understands those changes. And I did that because in my first pregnancy or in my first postpartum, I had really bad anxiety. And then my second, I had depression. And I really wanted my third to be a different journey. And what do you know, it was. So, was that the therapy? Was that just third time mom energy? Like, I've got this now. I don't know, but it definitely didn't hurt. And another thing that I'll say regarding the sleep piece is if it's not a therapist, if it's your best friend, if it's your mother-in-law, if it's someone down the street that you've connected with, like don't be afraid to ask those people for help or to reach out to them and to make a plan before your baby is born. I can't tell you how many times I get a new follower who says, "Oh my gosh, I wish I found you when my baby was a newborn," or "I wish I knew about this with my first baby." Like I can't tell you how many people think that sleep will just be this easy thing. And sometimes it is. And for those parents, I'm happy. I'm very happy for them, I promise. But a lot of us don't have that easeful experience when it comes to sleep. And then we're left feeling like we're doing something terribly wrong. So I definitely recommend doing a little bit of research about how babies sleep normally. I have so much information on my blog about that. You can reach out to one of our consultants as early as you'd like, even if you want help. Sometimes we'll help parents set up their nursery or come up with a schedule for their partner to take on some of those night wakings and to get confident in that so that mom can get the rest she needs. There are so many different ways that you can set yourself up for support before baby's born or in those first few weeks to really just take a little bit of the load off of your mental health. Because not sleeping can be really difficult, and a lot of first time parents are not prepared for how hard it can be.
I love that. And also, sleep is like at the top of the list of one of the most important things, even before we think about medicine, for example. And so, we really want to make sure that sleep is under control. But when you don't have those tools, when you don't have a partner or like an idea of who else can help you, it's really tough. I also love, and this is so integral to our work, is how Rachel includes sort of flexibility, that there's
Yeah.
no right or wrong way, because often the messaging I got, and certainly the sleep training or books that I was reading before having my first, was like, if it doesn't happen this way on this schedule, something's wrong with you or your baby. And that I think is really difficult messaging. And I even integrate that when I'm like a physician, and I know I also didn't get no good sleepers for me. But I think that was a really hard lesson. And I think there's some really regimented, inflexible sleep kind of schedules that people are circulating. And that's really hard, in the same way that when you have this really fixed idea of this is how my birth is going to go, that can actually be really harmful, because we need some psychological flexibility of like, I hope this is what happens, but I'm going to kind of move and roll with it if it doesn't.
Mhm. And to your point about just like all of the things that are circulating online, that's another thing that I would tell new parents, especially when it comes to sleep, is everybody has an opinion. Everybody thinks they have this like secret code that nobody else has, and I promise you it's not that simple. So really take care in your pregnancy and your postpartum to really weed out your social media feeds, really curate your feeds, block things you don't want to see. You can use certain words that you don't want to see. You can block a lot of content on there now. And I definitely recommend doing that because, like you said, there's no village anymore. A lot of us look to these online creators and experts and all of that stuff to be our village. And sometimes it really does do more harm than good. So,
Or our village, raised children in the 80s.
Yeah.
right.
And like things have changed a lot, or there's like different ideas, like cultural ideas. For example, my mom is from Latin America, and sleep training is like not a thing. It's like very cruel to not go and be with a baby when they're crying. Actually, like, and so again, that's something that's very common in Commonwealth English speaking countries, but it's not something everyone does. And so it's really interesting to think, but guess what? People all over the globe are sleeping just fine as adults. They don't have to be sleep trained in a very regimented way.
I want to just make sure we get to this question in the chat. My baby will be in the NICU in a couple weeks, at least for their first part of their life. Any advice or resources on sleep for those babies?
Yeah, I actually recorded a podcast episode. My podcast is called No One Told Us, and I did a really special episode with two NICU moms, one of whom now supports moms going through the NICU process, and the other one just happened to go through this experience. And we talk a lot about kind of the differences that you'll see with NICU babies and sleep and some of the things that you can do to support. So I definitely recommend checking out that episode.
I'll follow up after this,
I
Becca.
can send you the link to share too. Yeah.
Great, that would be amazing.
And then in terms of what happens in the NICU, you know, there's a care team that's there, but open communication is important. And I think during those times, focusing on support for you. This can be a really, really challenging process for parents. That separation from your baby so early on can be so unexpected. So certainly, I think checking in, figuring out how you can get the care you need, the food you need, the sleep you need, and know that there's really fantastic, hopefully care team taking care of your baby, I think is important.
Yeah, sending you lots of love, Becca. That and we're here for you to support in any way that we can. Leah, talk to us about undersupply, oversupply, what's normal, what you can expect those first few weeks being home with your baby. And I know everyone's experience is different. So first and foremost, of course, fed is best. But if you are trying to breastfeed, what are the few things that maybe you can expect?
Yeah, I think that's perfect. And I think just talking about this rigidity that Rachel and Dr. Orrick highlighted is super important, because I think I often tell parents, like, if you were type A, you're gonna have to kind of let that breathe, because it's just, there's so many factors that we can't control. I also feel like parenthood is sort of like this club that you can like read about and learn about, but until you're in it, you're not really like a member. It's hard to understand a lot of those pieces. And so when it comes to lactation and your supply, there's a multitude of factors, everything from the type of delivery you had, how long your labor was it vaginal or cesarean, induced or not, as well as early day stimulation to your breasts, how much the baby's latching, how much you're pumping if you're not don't have accessibility to your baby, will determine your breast milk supply. And that's why it's just super important to do your best to try to have a prenatal appointment, so that like when baby's here, you're reaching out to your LC to say, okay, this is what happened. This was our plan A. I think we might need to enact plan B to get things going. And so there's a varied amount of milk that you'll see online in terms of like what people say is normal, really between 750 and 900 milliliters a day, like in a 24-hour period. Now, most of us aren't quantifying our milk this way because we're not pumping exclusively. So that's for an exclusively fed baby who is getting the breast milk from mom. So that's kind of a very unique situation. And again, it's based on baby's weight, how many times baby's feeding per day. And so it becomes a very individualized thing. So I love static resources for basic information. And then that's where your care team steps in on the more, this is your situation, you and your baby. And so what I find is typically the first week of life, what we're trying to do is establish stimulation and change your hormonal profile so that your body knows to start making that breast milk. And we do that again by lots of skin to skin with baby, as much breastfeeding as possible. Hand stimulation, like hand expression, is a great resource for that, using a manual pump and sometimes using a regular pump. And then really, usually by week 2, we have a good idea of what's going on with supply. And so we don't usually see, surprisingly, undersupply or oversupply unless we have a very pointed reason why that's happening. Typically with oversupply, we have a mom that feels the need to like slap the haka on every time she goes to breastfeed on the other side. And she's doing...
It was horrible.
I know, you were one of those offenders.
I was an offender.
No, but I think you think you're supposed to. I think when you don't have guidance, you're just like, well, more milk is better. More milk is always better. And the internet kind of tells us that too, right? So social media praises these moms with like stashes of breast milk. in their freezer. And I'm like, why would you want that? Like, why do you want 300 ounces of breast milk in your freezer? Why do you want to have to buy a deep freeze, right? And so I think like if you just think about trying to navigate on your own, there's just so much information flying at you from all different sources. So I think, there's lots of signs of adequate feeds when you breastfeed. And again, that's something that's super hard for some families. And so having guidance on, is my baby gaining weight appropriately? Is my baby having enough wet diapers? Is my baby having enough poopy diapers? These are all signs that we have that help us know if your baby's getting enough. And then your pediatrician's appointments plus additional weight checks will help guide us in those early weeks. Usually once we get to about 4 weeks, that gives us a really good idea of what we're dealing with in terms of how well is the baby getting milk out of mom, what's the weight gain pattern and such. And there are unique babies. There are babies that land weirdly on the growth curve, where they like go up and then they might kind of plateau and then go back up. And these are all really specific situations that can happen, and it can be a little disheartening to parents. And so having that guidance throughout that process just gives you the reassurance that things are okay and that you're doing things the way that you want to, while also meeting your goals and making sure your baby is fed, like Lily said. So I think it is super nuanced. So I know I didn't really give like really clear guidance on under or oversupply, but I think it's just so specific to each mom and baby. And so making sure that you have people you can talk to and get guidance is key.
Yeah. Thank you for sharing. That is really helpful. I had a C-section the first time around, and I think I interviewed the author of this book, The Mother Load, yesterday, and part of the conversation was around you are the patient, this is your care, and if for some reason you feel like you're not getting the right support from your doctor, you can potentially switch if you want to. And at the time, I had a doctor who at my 6-week checkup, I didn't feel normal. And Jada, this is kind of coming to you, but she encouraged me like not to do PT. And it was interesting because she made me feel like PT was only for a vaginal birth. And so I'm curious to you, like, who is PT for, and is it necessary for all birthing parents?
Yeah, I love that question. It is absolutely for everyone. PT is
Okay.
for everyone. It does not matter how you delivered your baby. You went through birth no matter what, and you deserve physical support for your recovery. There's so much that goes into both vaginal and cesarean deliveries, but particularly with a cesarean delivery, it's a major abdominal surgery. And so that requires training on how to re-engage your ab muscles, training on how to move without injuring yourself, how to pick up and put down your baby without injuring yourself. It blows my mind that someone can have a major abdominal surgery like a cesarean section
Not see a
and
doctor for 6 weeks.
right, and be told don't lift above a certain weight when your baby might even weigh more than that. So it in a lot of ways almost more immediately is important with a cesarean section to have PT as a support system, because you don't know how best to support your body, engage your core. You don't know if it's safe to tighten your abs. You don't know really what to do because that we don't really prepare mothers for what to expect.
Yes.
So absolutely, it is necessary for all birthing people. Yes, and I can't recommend enough how important PT even once during pregnancy is, so that no matter how you deliver, you have a few tips on how to move best in those first few weeks, in order to curb any lasting injuries or issues. So yes, for everyone, absolutely everyone should be consulted by a PT.
Yeah, you used the word I liked when you were first speaking, which was preventative, and that's a nice word because if you can do something to set yourself up for success post birth, why not? You have a question coming specifically to you, Jada, which is with my first pregnancy around 24 weeks, I developed really severe pelvic pain where I really had to stop going for walks, definitely couldn't continue gentle prenatal yoga. It was quite debilitating. I was told it was in the, oh God, public
Pubic
Dr.
symphysis.
Or Jade, I may need a medical expert for this one.
Okay.
Public syphil, whatever.
Pubic symphysis,
Iliosacral
joint.
Great.
iliosacral.
I asked my OB if there was anything I could do this time around to get ahead of this, and I was told it is what it is. Anything you would suggest?
Yes, yes, absolutely. I see so many patients that come in during pregnancy with pubic symphysis pain, which is that pain basically right in the bone, right underneath the belly, essentially. A lot of times there's sharp pain with movement, and it generally hurts when you're sitting up or standing up from a sitting position, turning over in bed, getting in and out of the car. Stairs can be difficult, or even just like lifting one leg to put on socks, shoes, pants, that kind of thing. And so really adjusting the way that you're moving in those instances can really help to reduce pain. So what you want to do is try to avoid instances where you're moving one leg away from the other. Those are generally the movements that are creating movement right here, which is where the pubic symphysis is. And so when this moves, when your pelvis moves as you move one leg away from the other, that generally causes pain. So when you're doing something like getting out of the car, instead of just moving one leg out of the car and then the other leg, you want to keep both knees together and shift your whole body until both feet are facing out of the car, and get up with both feet together. When you are standing up from a sitting position or turning over in bed, before you do those things, you want to inhale, let your belly expand, and then exhale, draw your belly button back towards your spine to tighten those low core muscles, and then hold that contraction as you turn over in bed or as you get up into a standing position.
I just did that with you. I need to
It feels better, right? Whoever is on this call, if you want to try that, inhale, expand, exhale, draw your belly button back towards your spine and hold that as you stand up. And it helps to lift a lot of the pressure from the belly onto the pubic symphysis. So less pressure equals less pain. And as a bonus, you also get practice tightening your low core. That really comes in handy when you're lifting, carrying, rocking your baby in postpartum.
I was going to say, Jada, these are great too if you have any perineal damage for after postpartum. It's a good way to get in and out of the car and in and out of bed. So
definitely.
Tell us what
also
that means, Leah. People don't know. What is perinatal?
So if you have any tearing during your delivery, which is pretty common, especially for first-time parents, you're very careful then about how you get in and out of your car and get in and out of bed and those types of things. So you get in the practice of moving this way, these are the same ways you'd be getting in and out as well of your car in the postpartum period to protect that perineal tissue as it heals.
Got it.
And one more thing too with pregnancy, if you're feeling that pain, a belly band can be really helpful too. So two of the big companies like Baby Belly Band or Belly Bandit sell bands that basically just go around your whole lower trunk area and then underneath the belly so that they lift a little bit of that pressure off of the pubic symphysis. So if the pain is pretty much constant, like when you're on your feet or walking around, a belly band can be super helpful, especially if it is say a second or third pregnancy and you're taking care of other kids. So you have to be running around and on your feet a lot. Having a belly band can be super helpful for those days.
And can you sleep in that, or is it just for during the day?
Just for during the day. And generally, like if you're sitting for prolonged periods of time, it might not be as comfortable, but especially when you're on your feet, you have to go to Costco, you're going to Disney with your other kids, those long days when you're on your feet can be the most helpful.
Got it. All right, Sarah, antidepressants while breastfeeding and expecting. You know, I love my Zoloft. I'm not going off of it this time, but there are.
I think people have a lot of concerns around it, of course, but it is antidepressants, specifically these SSRI, that selective serotonin reuptake inhibitor medications, are some of the best studied in pregnancy and the postpartum. This is more than insulin. This is more than a lot of medications for high blood pressure. And you would never tell your doctor like, oh no, I'm going to try to manage my blood pressure like I'm all good. And yet there's something around, and there's so much stigma, I think, still around these medications that they feel like a choice, like they're somehow for performance enhancement, not because you need it for the symptoms and to like have a good quality of life. So I think that becomes really challenging, and it's more of kind of talking to your practitioner. Of course, everything has risk, just to be clear. But what we know about these medications that they don't have an increased congenital risk of congenital defects, which is hugely important and very, I think, significant. And just in general, we've had babies now that have grown up and are in, their teens, adults that have been followed after being exposed to these medications. And we see that neurodevelopmentally, they're completely sort of normal. And what's really interesting is that there's risk to not taking medications and not treating your mental health issues. And we don't often think about that. You're actually not weighing the risk of medication versus non-med. You're also weighing the risk of untreated symptoms that maybe aren't fully covered by therapy versus the medication risk. And we know that untreated symptoms of depression and anxiety can lead to preterm delivery, can lead to small for gestational size, increased NICU stays. There's increased ER visits with parents in the postpartum when they don't have, when they're feeling a lot of postpartum depression or anxiety. They're also maybe not getting the vaccines their kids need. So there are huge implications to this, and some we're just starting to learn about. We know that when you're not treated for your mental health symptoms, there's actually risk to the mental health of your babies when they're in terms of neurobehavioral issues, so like ADHD and behavioral regulation, which are independent of your own kind of genetic risks. So that's really interesting. But I think we have to look at it in this nuanced way. And again, with breastfeeding, we've done so much studies on this that the amount that gets in the breast milk is very small. And especially if you were taking them during pregnancy, what was transferred to the baby in utero was a lot more. So it wouldn't make sense to say I was taking this in pregnancy and I'm going to stop because I'm breastfeeding, for example.
Oh, that's really nice to know.
Yep.
Yeah. And there is a doctor who Dr. Hale is his name, who widely studies drugs in breast milk and has a very good resource. A lot of lactation consultants, your hospital is going to have it. A lot of pediatricians have this textbook, as well as access to the app that allows them to look for the most compatible. But just to note, most SSRIs are considered completely safe.
Oh, I'm going to look him up because I feel like a lot of the things that you hear is that there's just not enough research on some of these things. And if that's not true, then I want to know.
I think the issue is that we haven't done randomized control studies on pregnant and postpartum women because of the implications of having a fetus that's not participating in studies. But this is a long-term issue with a lot of women. We weren't included in studies until very recently because of the mere fact that we menstruated. So we don't have the quality of data that we would for other issues, for example, but we do have an aggregate of millions of women who have been on this because there's countries, specifically the Scandinavian countries, that actually have a lot of data sets of here Lily was on Zoloft during this, what kind of issues did her baby have? And so we have huge data sets. They're not controlled for different variables, but we generally can assume some sort of like patterns that we've seen.
Relationships and setting yourself up for success with your partner. Rachel, I think you've told this before, but you had a plan with your husband about overnight shifts, and I think leading into maybe not your first, I can't remember what you've told me in the past, but what was the system in your household that worked, and how can you set yourself up for success with your partner when it comes to sleep?
Yeah, definitely not with our first, because I kind of had that mentality that so many new moms have of like, I can do it all. I should do it all. If I don't do it all, I'm not good at this. So I really wanted to be the only one making it. Also, my partner was working outside of the home, and I thought, oh, he can't possibly be tired if he's working outside the home. And it's like, we're doing work inside the home too, even on maternity leave, and we need and deserve rest too. So one thing that we did differently with subsequent babies, and that we recommend to clients often, is doing kind of a shift system. So, and maybe Leah can talk a little bit about how you can incorporate breastfeeding or pumping in with this. But it can be really, really helpful if you're not getting consolidated sleep from your infant yet, which is normal. But even just having like a 3 or 4 hour chunk once per night, even if that's just a couple times a week, can be really, really impactful for your physical and mental health. So one way that you can do that is having your partner do one of the wakes. And for lots of families, the way that works best is them taking that first shift of the night. So you put an eye mask on, put your headphones in, whatever you need to do to get your room totally dark and cozy so that you can sleep. You go to bed early, you go to bed at maybe like 8 or 8:30, and then your partner takes that first wake up. Maybe it's 10 o'clock or 11 o'clock so that you can sleep through till maybe midnight. They could even bring your baby to you and latch them right on so that you can breastfeed and take them away and do the diaper change and the soothing back to sleep. So whatever it looks like for you, there's no one total right or wrong way that's going to work for everyone and everyone's schedules, but just kind of having that conversation can be so incredibly helpful, because I think a lot of partners are actually really willing to help and they really do want to be involved, and it really helps their confidence to feel like they have that special bonding time with their baby too. So it really is so beneficial for everyone, especially in the newborn period. And then if you're having a second baby or something like that, maybe your partner is on toddler duty. If your toddler wakes up and needs water, or needs to go to the bathroom, or has a bad dream and needs to have somebody snuggle with them, or whatever it is, you can then kind of set up your shifts in that way where you're more of like a man-to-man kind of thing. But yeah, it's really helpful. And a lot of parents don't do it because they just feel like it should be all in one, but it really shouldn't.
So Leah, how can your partner support overnight when it comes to feeding?
Yeah, so I actually encounter this quite a bit where exactly like Rachel said, it's like there's this interesting mentality that's like, I must just suffer all night, like, and there is no other option. And I think to her point, we really do empower partners when we give them tasks and we trust them, right? So that's another part of this dynamic in our relationships in parenthood, is trusting our partner to know how to soothe the baby, to know how to feed the baby if you're doing bottle feeding, to know when, like, to see the signs that baby's getting hungry and know when to bring the baby to you if you're breastfeeding. So I think just really thinking through empowering, right? Like, so sharing information and trusting, like giving that up. There's a part of us that I think like try to grip on tight to some of this, even though it's like it allows us to sort of like be the martyrs of the situation, but it doesn't benefit anyone. It doesn't benefit our partner. It doesn't benefit our mental health or our ability to recover. And so very similar to Rachel, what we do is we talk about schedule and we talk about what is the longest stretch baby's doing. And it does depend on how many weeks out we are and those sorts of things, but just talking through some parents, some mothers, and probably Dr. Orr can speak to this, even the sounds of their babies can be really hard for them to seep through, every little tiny squeak. And to be honest, newborns are kind of loud, I think. Like they're not very quiet. And so, removing, like having, partner and baby in another space for that first stretch, like Rachel was saying, can allow this like deeper level of sleep. And it's surprising how that 3-hour, like uninterrupted, undisturbed sleep is so impactful when you're a new parent. And I make the joke, like, I'm like, I haven't had a full night's sleep. Like when my kids were probably still like 10, 8, and 6, I'm like, I don't sleep through the night. Like, I'm like, for one reason, somebody's up. And I was like, I function on interrupted sleep, like amazing, my whole parenthood journey. But I think making sure you're getting some interrupted stretches can be very important. Some people will flip flop and do the early morning feed stretch becomes like mom might feed at 3 a.m. and then baby leaves the room with dad and dad lays on the couch, baby's in the bassinet out in the living room, and mom gets that early morning stretch. So I think it just really depends on what works best for you, for your schedules, your work schedules. But I agree that I think it's super empowering to partners to involve them regardless of the feeding choice in baby's care. And I could go on and on about partner support because I think it's just
that's a whole event in itself.
Yes,
I
think it's so meaningful. Yeah, it's so important.
Jada, one thing that we got asked in the community was, what are signs that something isn't healing properly? Because you don't see the doctor for 6 weeks. You don't know what's normal, especially if this is your first.
Yeah, absolutely. So basically, there are a lot of symptoms that can be common in the first, 6 to 8 weeks postpartum, but common doesn't exactly equal normal. So I think knowing the difference between what might be common versus what's normal is really important. If you're noticing bleeding that feels like a lot and you haven't been checked by your doctor, definitely important to contact them just to make sure that nothing's wrong. They can check you out. If you are noticing like heaviness in the pelvic area or the vagina, pain after bowel movements or before bowel movements, or any sort of leaking, either urine leakage, fecal leakage, or painful penetration, those are all reasons to make an appointment with a pelvic PT. If you're noticing those in the first 6 to 8 weeks, there are a lot of cases in which those do go away after that, but that doesn't mean that you shouldn't get them checked out. Just because a lot of people will tell you, oh, well, you had a baby, so that's normal. But no one should be peeing their pants when they laugh or sneeze. No one should be having painful sex or painful speculum exams or anything at the gynecologist. No one should be having pain with bowel movements. Those things are not normal. And so they're definitely a reason to get checked out. If you see your OB at 6 weeks and they clear you, just because you've been cleared also doesn't mean there's nothing wrong with your pelvic floor. So know that if you're noticing those things, you still absolutely should make an appointment with a pelvic PT. They're going to be screening you for red flags at that 6-week checkup and making sure that you're safe, but you still could be experiencing pain, leakage, heaviness with activity, those kinds of things. So definitely if you're experiencing those, make an appointment.
Okay. Dr. Oric, so many people in my life have felt not connected to their baby right away. Can you talk about that? Is it normal? Is that a sign of postpartum depression? Um,
Yeah, I think this is interesting. And in some ways, it's like a cultural fantasy that we've all built that somehow this is the most important and special and fantastic moment. But for many, there may be trauma in the birth experience. You may be a little bit out of it. You may be laboring for hours and hours and hours. You may have just had a major surgery. And so that connection may be difficult. And I think we just need to be more open and talking about everyone's kind of varied experiences versus the idealized kind of Instagram experience of it all. So I think for many, your body has been through a lot. You do not know this person, though you've grown this person.
stranger.
Yeah, it's a stranger. You need to get to know them. And I think it's just a complex situation. I think there's also with birth and transition to parenthood, a lot of grief and loss for what you had before, your body. Like there's just so many complex feelings. I don't think it's unusual for this to happen. And I certainly don't think if this is your experience in those first couple hours, that doesn't mean you're going to have postpartum depression. It just means that you've been through a lot and you maybe not, you're not as connected yet with this baby. It will soon happen, but it takes time for some people to build that connection.
Yeah. I was definitely one of them, and I felt like ashamed to admit it at the time, but
Yeah.
it's so common.
Yeah, and also some people just aren't infant kind of baby,
I'm not
like
an
there's
infant
an
person.
infant. Yeah, I neither was I. I mean, I thought, oh, this baby's so cute, but like I've also been through a lot. I don't know. I don't even know exactly how I'm feeling yet. I haven't fully like processed this whole birth, and this certainly can even be more challenging for people who maybe have had used a surrogate. So there's a lot of complexities, but that also doesn't mean that you're not going to connect at some point. Just, it might take you a little bit longer.
Yeah. I know that we're coming up on time. I want to make sure that people are getting their questions answered. So if you want to open it up, take off, mute for a second and ask a question, we're here to answer it. Of course, no pressure, but I do want to give that opportunity. So I'll do an awkward 10 seconds of silence to see. All right. Well, ladies, Dr. Aura, Leah, Rachel, Jada, thank you so much. It's conversations like this that I hope are changing the narrative for a lot of people and having people, of course, prioritize baby, but also prioritize themselves. So I'm so thankful for your time and your wisdom, and I'm sure everyone here is as well too. So Thank you so much.